preventative care is great stuff if you have the person in front of you and you know the person and during their physical, because I do believe in the physical exam. By the way, they're trying to get rid of the physical exam because they don't feel who they are, which is the people like, who is that? U.S. Preventive Task Force and Cochrane stuff. They always debate whether a physical exam was worth it. And I'll never give up on that, or never did, because that's how you learn about that person and pick up things that wouldn't have been picked up. And if you look at the model, it's models based on cost. So when you look on some of the evidence, well, why wouldn't you have physical exams to everybody? Because they can't get them all in. Well, we could.
Yeah.
So if you could, and you had the time, and it wasn't an expense because it's part of their membership, and a very cheap $75 a month membership, you really do pick up a lot of stuff, right? I mean, when you think about the guy who took over for me, I had a conversation that was really enlightening. I said, why are we? The evidence is not. It doesn't show that you should check for a TSH or thyroid. It's not. The evidence doesn't show that's appropriate for a screening. I'm like, why not? That was because of cost. The cost is so high. It's the only reason. Because if you got a TSH come back at 10, you're hypothyroid. I caught so many people way before they were symptomatic. And so, Cochrane and everybody else says, well, it's not cost effective. Well, what if the cost is $10? Because that's what the cost is in our office. That changes the whole game. That changes the whole paradigm. So and our labs were like that. A CBC is $5. And so if you did a CBC and someone's, white count was 2 out of nowhere, that was worth it. Those kind of things, I think, are at least debatable. And so,
sure.
So that's what's cool about direct primary care. You start thinking about, okay, well, what labs really be worth it now for patients? And can I, versus that whole model that we were taught in the industrialized model is based on a mass cost thing. And now this is much more personalized in primary care.